In Kenya, we use OTOI-NARIMA model to support planning, budgeting, surveillance, and response. A locally developed mathematical model. The model uses daily case infections collected over time, and this is also calculated into moving averages that are manipulated to coincide with reproduction number. Then it is run on scientific software, which is the R language. There are several successes that have come out as a result of using this model. We accurately predicted 6 COVID-19 waves of Kenya. We have presented our findings to the National Modeling Committee, where it has been represented and currently being used. The model prediction is also being used by the National Vaccine Committee to mobilize people to accept vaccine ahead of predicted surges. We made the presentation to the AU during the inaugural conference on public health in Africa. Both national and local and international media have reported on this model. There are some interventions that have come out, one of which was 17 advisories given by LREB Advisory Committee chaired by Professor Kamarogo. Assessment of health facilities to gauge how well they would respond to management of COVID patients in case of an upsurge. They've been planning for the burden of the pandemic and resource mobilization, where we have considered partnership, for example, with Farm Access Foundation, which has provided COVID DX, a platform, digital platform to strengthen health system and also to visualize the capacities we have and the infections as they occur in real time. The model does not use, if you look at the center lower bottom graph, we do not use case fatalities because people succumb or recover differently over time depending on multiplicity of factors, some of which are 1, age, 2, underlying conditions, and facilities in which these patients are hospitalized, whether they have high flow oxygen or not, they have medication or not, so they do not give good impression. We've also made a long forecast of waves between April 6 to November 4th of 2021. Now, when COVID Delta struck, we were expected to go the Indian way. The eminent committee of LREB Advisory recommended that we do the assessment preparedness, and we did that in all the 84 facilities and found gaps which presented to the governors as seen in the top right corner. Then the gaps were filled thanks to our governors' ability to heed scientific advice, and the bottom right corner shows where the wave was after the prediction, after the interventions. Now, when Omicron came, we were not surprised because it predicted it way back in September, and it struck in November 23rd and ran all the way to 29th of January 2022. By this time, we had started a partnership from Access and we're implementing COVID DX platform. That COVID DX platform, digital platform, enabled us to see in real time 2 dashboards supported by Power BI and ComCare application. We trained 179 HRIOs and 84 facilities, as well as 179 medical laboratory technologists. We provided 76 tablets and also 22 Android phones, which were data supported and internet enabled. Now, they used this to submit data to the dashboard every day by 10 a.m. From that, we had policy briefs. Now, the dashboard, this is just a demo, a clear, just a printout of what dashboard looks like. See the number of tests done, the types of tests that have been given, whether it's PCR or RDT, the number of facilities submitting that data, positivity over time. Then this is the capacity tool where we know the number of isolation beds available, 1,103, 42 HDUs, 63 ICUs, and 5 fully equipped ambulance, and the oxygen capacity in the facilities. Through digitization, we were able to know where infections were and the clusters of infection so that the leadership could act appropriately with evidence. We were also able to map out where different variants were, and so we knew the characteristics and implemented what was recommended. The national media with the highest circulation, that is the Nation newspaper, reported on the waves way before they happened, when they were just looming, and during the time it was happening, the number of people we expected, reporting the model and the minister giving some directions on how to manage the Omicron wave. With the visualization of the dashboard, we gave out policy brief on waning immunity. Like you see here, we said prioritization of booster shots for healthcare workers whose immunity had waned, as seen here in the dashboard. This was also captured in the media, as well as psychosocial support. The sixth wave was predicted, and some experts have different opinion, but we're currently witnessing, and we've given advisories on the same. As you can see, predicted sixth wave, and what we need to do: urgent increased testing and vaccination, and lessons learned over time. The media has been capturing this over time. We worked that way with the media covering the model. As you see, this model was also presented during the conference on public health in Africa. All this would not have been possible without what we did with the model. Thank you very much. That's the end.